The Trump administration is saying that they're going to stop the Affordable Care Act's risk adjustment payments to health insurers. What's that mean? This is Healthcare Triage News. The Affordable Care Act had 3 programs, known as the 3 Rs, that helped insurers get used to the new community-rated, guaranteed issue world of the exchanges. Those involved reinsurance, risk corridors, and risk adjustment. Reinsurance meant that if any one patient got really expensive, the federal government would step in and cover above a certain amount. It protected them from outliers. Risk corridors meant that insurers could, as a total amount of spending, be sure that they wouldn't be able to lose more than a certain amount of money. They also couldn't make more than a certain amount either. That's the corridor. Lower risk and lower rewards. Risk adjustment meant that insurers who wound up with lower risk patients overall, i.e. healthier, had to pay money to insurers who wound up with higher risk, i.e. sicker patients. It prevented the cherry picking that was prevalent before the Affordable Care Act. It's not about spreading money around so much as adjusting risk among insurers. A recent court decision in New Mexico gave the Trump administration the opening to announce they were stopping all the risk adjustment payments. This is massively important. Risk adjustment is a huge part of making the exchange market stable. Tens of billions of dollars are at play here, especially because reinsurance expired in 2016. It was supposed to be a short-term measure as the exchanges started. Risk corridors are gone too because Republicans in Congress killed them as part of a 2013 spending bill. This means that risk adjustment is the only big program left to help stabilize the market. If the freeze on payments is really short, then it's possible it won't amount to much. But if it's not, smaller insurers who don't have cash on hand could wind up in real trouble because they were expecting payments for their patients who were sicker than expected and they won't get them. That's not good for the companies or the patients they serve. Let's be clear, risk adjustment isn't a controversial communist plot. It's used in Medicare Advantage, the more private-y side of Medicare, and in Medicare Part D, the Medicare prescription drug programs. The risk adjustment keeps insurance programs from cherry-picking. Nick Bagley, friend of the show, has some thoughts on this. At our blog, he said CMS could move quickly to adapt a rule to address the judge's concerns. The Justice Department could file a notice of appeal, even while the motion for reconsideration is pending, and seek a stay pending appeal, first from the district court and failing that from the 10th Circuit or even the Supreme Court. Or the Justice Department could construe the court's order to apply only to the plaintiff that brought the suit, or perhaps more generously to any insurer in New Mexico. Risk adjustment could then continue uninterrupted elsewhere. The Trump administration decided to do none of these things. This might wind up not being a huge deal because things are somewhat fixed for the 2019 rule, and it's possible most insurers can handle the waits in their accounts receivable. But as a continued message that the Trump administration seems willing to do almost anything to sabotage the Affordable Care Act, well, that's a whole other story. Do you like the show? Always helps if you like or subscribe right down there. And another good way for you to support the show is a subscription service called Patreon.com, where you, the viewer, can directly support on anything you like $1 a month. More if you like, but if you don't want to, totally fine as well. Go to patreon.com/healthcaretrash to see how you can help. We'd especially like to thank our research associates, Joe Sevitz, Crafty Geek, and Jonathan Dunn, and of course, our Surgeon Admiral Sam. As always, go to hctmerch.com to pick up good healthcare triage merch, and my book, The Bad Food Bible, still on sale in stores.